We will wait about another minute to give all of you a chance to come in and get situated. Thanks for being here. Looks like we've got a good group. Thank you, everyone. All right, I'm going to go ahead and get started. Good afternoon to all of you. My name is Sherman Gillums Jr. I am the Senior Director of Public Policy and Advocacy for the Christopher and Dana Reeve Foundation. And I'm located in, right now, it's not too sunny, DC, but on most days we do pretty good out here weather-wise lately. I am assisted in my duties today by Angel Hines, Gerard Arnhem, and our awesome team from Waxman Consulting, who you will be hearing from shortly. And so welcome to this Regional Champions webinar. I'll start off with a few comments. It's been a trying year for us in the wake of the challenges to preserving funding for the National Paralysis Resource Center, which has been our #1 issue. I'm proud to say that we didn't take a passive wait-and-see approach in response to these developments that you all have been working on during my first 100 days on the job. And I want to just talk a little about some of the efforts that we've undertaken to preserve federal funding for the PRC. I started the week here, my first week here, at the 35th anniversary of the Americans with Disabilities Act event at the U.S. Department of Health and Human Services, along with other senior leadership at the Reeve Foundation, as well as at the Administration for Community Living. We did interact with Secretary Kennedy, and we at least made a showing and made it clear that we're going to be present and we're going to raise our voice on this issue. And I was privileged to represent the Reeve Foundation on a 21-station radio media tour that we just wrapped up last week. And Gerard's going to talk to you a little bit later about some of the other ways in which we've worked with you all to make sure that our voices were heard, which is real important right now. Now, as you know, a government shutdown has added uncertainty to a lot of the uncertainty around the funding for the PRC, as government agencies are right now being reconfigured or in some cases eliminated altogether. And at times the situation can appear hopeless. But as I always say, history doesn't repeat itself, but it does move with unbroken continuity. And that's where we as champions do our work, like the many who have come before us, who faced even greater challenges. And I'll talk about a few of them. There was a time in this country when we had ugly laws, and it was during my lifetime. I'm 53 years old, and up until 1974, there were ordinances in certain cities where if you were disabled or if you were unhoused, you couldn't be out in public, all right? And it wasn't until 1974 when the last ugly law was rescinded in Chicago. Shortly after that, we've all heard about the champions who fought for the Rehabilitation Act of 1973, as well as the Americans with Disabilities Act in 1990. We've seen times like this before. It's never the case that all hope is lost. Right now, it's just our turn. This is October. This is Disability Employment Awareness Month, which is pretty ironic because I, as a person with a disability who is currently employed, sit at the front lines along with all of you on this very fight that we're talking about. So as we celebrate October being Disability Employment Awareness Month, I also want to celebrate you all in the work that you all have been doing even before I got here to the Reeve Foundation. And you all now serve as the formidable champions at this time in our history here to make a difference. And so in many ways, times like these give purpose to everything we've endured, as we've proven our durability in the face of personal hardship. And now we have to demonstrate that same durability to prevail on the issue of our time, which is what we'll talk about here today. And this webinar is our aim to equip you with everything you'll need to do just that. So I hope you enjoy it. Hope you participate. And at this time, I'll turn it over to my colleague, John Sawyer, who's going to begin the presentation. We can pop up the agenda there. I realize I didn't give everybody a preview. We're going to go through congressional updates, coalition updates, grassroots, and then we're going to hear from you all. John, take it away.
Great. Thank you so much, Sherman, and thanks to the Reeve team and to everybody who's joined the webinar today. As Sherman said, I think there's a lot of uncertainty in the environment right now. We want to give you kind of a snapshot of where things stand, but there's also real reason for optimism in and around, in particular, the fight over PRC funding. So we can go to the first slide and let's talk about what is probably on many of your minds and what is on many of the front pages around the country, which is the ongoing government shutdown. Just to give a little bit of background, a government shutdown in this way arises when Congress fails to reach a deal to extend government funding. And there's two ways government funding or appropriations work on an annual basis. The federal fiscal year ends on September 30th. And typically there's three things that can happen at that point. Congress can pass a bill that funds the government for the whole year and goes program by program, deciding how much funding each program will get. They can pass what's called a continuing resolution, which is a short-term stopgap that will put the government essentially on autopilot at existing funding levels for a specified period of time. Or if they don't succeed in either of those paths, a government shutdown begins. And so that is where we are. The main dispute is between the parties in Congress. House Republicans and the House of Representatives has passed one of those short-term continuing resolutions, or a CR, that would extend government funding at existing levels through late November. Senate Democrats in the Senate, these kinds of bills require 60 votes. And so they require Democrats and Republicans to support that legislation. And Senate Democrats have held out their votes to fund the government, essentially insisting that healthcare policy changes be attached to any extension of government funding. Probably at the top of that list of changes they would like to see are that tax credits or subsidies that help people afford insurance coverage through the Affordable Care Act. Those enhanced subsidies are set to expire at the end of the year. Without an extension of those subsidies, as Democrats have been proposing, it's projected that people's individual health insurance premiums will increase by anywhere from 20, 30, 40% up to almost doubling. It's not entirely clear, and a lot of things go into that calculation, but Democrats are pushing for an extension of those enhanced subsidies for health insurance. And so without finding resolution over that at the end of September, at the end of the federal fiscal year, appropriations and federal funding is now in what's called a lapse. That does not mean that every single function that government supports has shut down. It does mean that many federal workers are being furloughed and are not being paid until the shutdown is resolved. And then there is a lot of discretion that the administration has on what programs operate at what levels. As all of you know, the Paralysis Resource Center is supported by federal funds, but the PRC currently is operating through July using essentially funds that were provided by Congress last year. And so the PRC continues to operate. The shutdown is affecting our partners at the Administration for Community Living, many of whom are furloughed at the time being. There were also some new announcements of actual layoffs at the Department of Health and Human Services over the weekend. The details on those are continuing to trickle in, so we won't go into that until we have a clearer picture of what is happening there. But suffice it to say, I think Sherman put it really well, that this adds a level of uncertainty to the process, and it's something we're monitoring closely. What I want to share too, though, is that before the shutdown took place, we made some major progress. And if folks remember, and if you were joining these calls at the beginning of the year, early in the year, we saw the new administration in its budget proposal, which is just a proposal. Congress ultimately decides the budget. In the administration's budget proposal, they proposed eliminating the National Paralysis Resource Center and turning those funds and funds for several other programs over to states to administer. The good news is, at a committee level, both the House and the Senate Appropriations Committees, who ultimately decide these funding levels, have released their bills. And in both of those bills, in House and Senate, the PRC funding is restored at a full level of $10.7 million, which is equal to last year's levels. And so this, and Gerard will talk much more about this restoration of funding, while not final, and we'll talk about, there's still a road to travel here, but this restoration of funding is a direct result of the advocacy that this group, that many of you, that your partners, that advocates around the country took on, especially over the summer, to educate members of Congress and their staffs and activate the community around the idea that eliminating the PRC is just a bad policy choice. And so really we'll talk about the grassroots piece of this in more detail in a little bit, but everybody here should be taking not a final victory lap, but taking credit for the fact that both House and Senate have chosen to fully fund the PRC. As I said, it's not over, and so looking ahead, we'll have more activity for folks to do. We can go to the next slide, and I want to back up in time a little bit because it's been a little while since we've had this group together. But the other major change and major policy moment in Congress over the summer was passage of legislation known as H.R. 1, or the One Big Beautiful Bill Act, into law. This bill, which was able to pass the Senate because of budget rules with simple majority vote, as opposed to those 60 vote thresholds for other bills, contained a wide variety of policy changes. It included increases in defense and border funding, extension of tax provisions that were set to expire, and major changes to healthcare programs, including and especially the Medicaid program, which is so vital to so many people in our community. Just to highlight a few of the Medicaid changes, there are new requirements that will go into effect in 2027, known as community engagement requirements. These are also colloquially referred to as work requirements. And this will, for the first time, condition Medicaid eligibility for certain people on fulfillment of a work obligation. So either 80 hours a month in a job, or in job training, or in education or community service. Much more detail to come on those provisions, including from the federal government, but those provisions are probably the largest and most significant change. Many groups of people are exempted from those new community engagement requirements, including certain groups of people with disabilities. But again, the administration will have to issue more detailed guidance on exactly how those exemptions will work. Some of the other changes, there are new restrictions on how states can finance their Medicaid programs. This is expected to lead to some loss of Medicaid coverage, as are the community engagement requirements, and some contraction of funding for Medicaid overall. Also, new requirements that the government determine an individual's Medicaid eligibility twice as often. Current policy is that that redetermination happen once a year. The new law requires that it be done every 6 months. And there are changes to and restrictions on Medicaid eligibility for lawfully present immigrants, those who are in the country under refugee status or other lawful means, have had historically some access to the Medicaid program. That will be changing in particular ways and being more restrictive. So this is a long implementation timeline for this new law. It's a major law. It's probably the largest changes to Medicaid since passage of the Affordable Care Act. And that implementation will be happening jointly at the state level and at the federal level, as Medicaid is a joint state and federal program. So we'll be monitoring that very, very closely, and probably as a foundation and as a grassroots team weighing in with the administration as they put out draft regulations and other rules going forward. Those are the main developments from the congressional side. I'm going to turn it over to my colleague Celicia Lomax just to give a brief snapshot on the administration side, and then I know Angel is going to fill us in on a wide variety of other issues we're engaging with through coalitions.
Perfect. Thank you so much, John, for passing over to me. As he mentioned, my name is Celicia Lomax. I'm a director of health policy at Waxman Strategies, who we've all had the great opportunity of working with the Christopher and Dana Reeve Foundation for a few years now, and a lot of this through and with the support of so many of you all here. So it's great to see a number of you here with us. I'm going to briefly go over some of the sort of updates from the administrative side, but recognizing that this year, I know there have been a ton of different changes that have happened. So I'd like to highlight just a few of the pieces on the administration side that would be most relevant to this group. The first is that there was a celebration of the 35th anniversary of the Americans with Disability Act, with Disabilities Act, that happened in the end of July. And as Sherman mentioned at the very beginning of this webinar, there were a number of folks from the Christopher and Dana Reeve Foundation that was able to join that, and it also included Secretary Kennedy talking, of course, about that anniversary. So that happened earlier this year. The Administration for Community Living, also known as ACL, also made a pretty significant announcement towards the end of September, in which they announced $60 million in new grant awards that went out to about 60 organizations or programs to various states throughout the nation, primarily focused on supporting older adults and Americans with disabilities. And to that extent, it primarily was funding provided for existing programs throughout the country. It also had some specific funding for caregivers, which we know is another really important priority for the Reeve Foundation. So we were excited to see that announcement come out of ACL. To that end, I think a number of you may have been hearing this, and this is something that we are all continuing to follow, which is that the administration is still working on and continues to pursue their reorganization of the Health and Human Services Department, and that includes a number of different agencies and programs within that department. And so some of that means that the Administration for Community Living may look a little different in the future. Some of those programs or staff may get moved around. But to that end, those changes do require congressional approval. And so, as John mentioned, right now, we are in the midst of a government shutdown. Those changes are not necessarily happening at this moment, but as they come to a negotiation and we see the government begin to open back up, there's possibilities that we'll see some of the ACL programs or staff or others start to move around within the administration. So we will, of course, keep everyone updated here and through the newsletter and other future communications about some of those changes and how it might impact the overall work at the Reeve Foundation. But those are some of the high-level updates on the administration side. So I'm going to pass it over to Angel to share some more on the coalition side and other work that's happening there.
Thank you, Celicia and Sherman and John and everyone for being here today. Before I get started, I just wanted to quickly respond to a question that was in the chat from Rob Allen. You had a question about any upcoming known changes to disability housing vouchers through HUD. And I just wanted to be clear, is that a question as far as any changes expected through the shutdown? Because I did see a notice come out that there shouldn't be any issues with any federal housing vouchers due to the shutdown. But if there's anything else, if I'm reading your question wrong, just send me a message and I can check with some of our coalition partners that do housing work to help you. So next slide. Gerard, I'm going to talk briefly about our congressional briefing, the Centers for Medicare and Medicaid Services proposed rule, accessible air travel, and just give a quick update on the spinal cord injury research program. So first, I just wanted to thank everyone who worked on. I know a few of you online today were able to attend in person, but in July we had a congressional briefing in Rayburn on the Hill in partnership with the Amputee Coalition, who run the Limb Loss Resource Center. And then we're thankful to have Alexandra Reeve speak, and Sherman also spoke, and some wonderful advocates, and Gerard will talk more about that later. But this was a very successful opportunity for staffers on the Hill to hear directly from you on how that the real impact of a federally funded disability resource center. So we were just very thankful that this went well, and we saw positive feedback when we received our funding and the bills that came out earlier this summer. So next slide. While he's getting next slide, first I'm going to start off talking about the CMS proposal for inclusion of the ostomy and urological supplies in our next round of competitive bidding. I saw that Sherry had a question about that, so I want to make sure that we kick off with that. A quick overview. What is competitive bidding? This is a program that CMS has created to lower the Medicare spending on various medical equipment like intermittent catheters, which are so important to the day-to-day life of our community. So this is why we here at Reeve and in partnership with the Item Coalition, we are working full steam on this issue. And I thank you to those of you on the call who also submitted public comments, letting them know why this is important to you. Next slide. So this is an individualized care needs. This is it's very personal to bladder management to each person. No one person's spinal cord injury is the same, and no person's bladder management care is the same. So that's why we came out and submitted adverse comments on this proposal, because it can really have an impact on the quality of care. It can increase medical spending due to risks like UTIs and sepsis, and increased risk of bladder cancer if you're not taking your bladder management. It just could be just very dangerous to your health if you have to suddenly not receive the catheter that you've relied on and chosen in partnership with your clinician. So this is why we oppose this proposal. Next slide. So in partnership with The item coalition, Reeve itself, we submitted the adverse comments opposing this proposed rule, as well as signed on to coalition letters. We've met with leadership at CMS. And we were invited to meet in person with White House staff. There are some of my partners from United Spinal and Powers Law Firm that runs the Item Coalition with senior staff at OMB on the executive offices. And we were so thankful that they wanted to hear from us on why this matters so much. So hopefully, we will know something in the coming weeks. The shutdown has slowed down this process, but I do expect to know the latest. There was a sign-on letter from members of Congress, a bipartisan letter that was led by Republicans that was sent to Director Oz at CMS and to Russ Vaught at OMB, urging them to not include urological supplies in the bidding program. So we're feeling really good about this, and I definitely will update everyone as soon as we find out the status. Okay, next slide is regarding the Department of Transportation's announcement that they were not going to enforce certain provisions of the Ensuring Safe Accommodations for Air Travelers with Disabilities Using Wheelchairs rule. This rule we all worked so hard on. This was a top priority of the Reeve Foundation, and so many of you shared your stories and submitted comments on this rule. So it was a little bit disheartening when we did receive this notice that they were planning to not enforce certain provisions. But I do want to clarify that that doesn't mean that the entire rule is not being enforced and is just done for. That is not true. There are just 4 key areas that DOT will not be exercising enforcement discretion. So that has to do with the liabilities, training, passenger notifications, and fare reimbursement. And the liability is a great way to explain that is if DOT issue fines on an airline, I don't believe that they are going to be enforcing that right now. But that does not mean if you have an issue, you should not contact the airline and file that complaint. Okay, so I just want to make sure people understand that. Next slide, Jared. I wanted to post this as a reminder, and I pulled this directly from the Department of Transportation's website. It is still there, it is still posted. And we worked with DOT as a partner to spread the awareness of the Airline Passengers with Disabilities Bill of Rights. So to remember that these are your rights, and if you have issues while you are flying, if you're not being feeling that you're being treated with dignity and that you don't feel safe, now more than ever, it is extremely important to contact the airline with your grievance and to still submit a grievance online, or you can call this hotline. We are continuing to monitor this and get more clarification on enforcement, and they are planning on issuing what we're calling a Wheelchair User Rule 2 in August of 2026. So I imagine there will be some advocacy that we will work on together to make sure that we are heard when they are developing the next rule. And next slide. And the last thing I'm going to talk about is just a quick update on the Spinal Cord Injury Research Program. This is through DoD, the Department of Defense's Congressionally Directed Medical Research Program, the CDMRP, which I know Sherman has worked on, and other people who are on the call as well. But this is very, very important to us here at Reeve research. And unfortunately, $40 million in funding was eliminated for fiscal year 2025, and there are ongoing advocacy efforts to restore funding for fiscal year 2026. We have been meeting twice a month with partners with Unite to Fight, United Spinal, and other coalition partners to work on this. And there is proposed congressional briefing on this topic to be held in early 26. So we will keep you posted on that. So I just said a lot, but feel free to email me if there's any issue that you have questions about. If I don't know the answer, I will try and find it for you. Okay, Gerard?
All right, well, thank you, Angel, for those wonderful updates, and thank you to Sherman, John, and Celicia. And thank you to all of you for coming in and being with us here on this webinar today. But for those of you that don't know me, my name is Gerard Arnhem. I'm the Grassroots Advocacy Manager with the Reeve Foundation. And in this section, we're just going to be speaking about some of our grassroots advocacy initiatives this past summer, the actions that we took together and the impact that we made. And I know John mentioned a little bit of it previously in the webinar. And we're going to close out this section just to talk about what is coming up next, looking ahead. But I just want you to all know that whether you've sent an email, you have either made a call to your policymaker, you had a conversation with them in person, or a conversation with their staff members, our voices is what drives change and what makes an impact. And I know in times like these, so much feels very uncertain, but being consistent in your advocacy is just more important than ever. So let's get to some recap. This past summer was definitely a summer of action. Our biggest grassroots push was around protecting funding to the National Paralysis Research Center. And as John mentioned previously in the earlier in this webinar, the president's budget proposal was released. I believe it was at the end of May, and it called for full elimination of funding to the Paralysis Resource Center. However, our regional champions and our advocates, we mobilized. You answered our call to action. We did launch an action alert, which asked advocates to urge members of Congress to fully fund the Paralysis Resource Center in fiscal year 2026 at no less than $10.7 million. And to date, we've had over 3,600 messages sent to the Hill, which is honestly incredible. And that was all because you filled out our action alert, you wrote your own lived experiences, and you sent it out. So let's keep getting those messages to the Hill. But yeah, regional champions reached out to their legislators' offices, educated them on the impact the PRC has had on their life. And again, this was done through email. It was done through meetings, whether they were virtual or in person. Attending town halls in your own districts. I know I got a lot of emails this past summer saying that, you know, X member was or so-and-so senator was having a town hall, and our regional champions joined in and shared their concerns about the Paralysis Resource Center. And I did include some pictures here on Capitol Hill, because even though meetings were done virtually, sometimes in some cases we were going up to Capitol Hill together and meeting with those staff members. So thank you to all of you who reached out and educated your members on the importance of the PRC. As stated earlier in the webinar, both the House and Senate versions of the fiscal year 2026 appropriations bill have been passed out of committee, and they both included full funding to the Paralysis Resource Center, and that is thanks to you. However, again, this is a great sort of victory lap, but our work is still not over. We have to remember that Congress needs to pass a full spending bill with full funding included. So just thank you to all the regional champions and advocates who took action and, again, your voices made a difference. And I just wanted to really quickly show some of these pictures we took during the summer. There's one where we were outside the Capitol building, and that was a very hot day. I know Angel remembers that, but just thank you all for really using your voices and making that impact. As we go on, this next slide will just include a quick recap of some of the activities we held this summer for our regional champions and advocates. But we did kick off this summer with a regional champions coffee session. And at this session, we focused on tailoring our story and lived experiences on the impact the PRC has had on our lives, and how we can convey to members of Congress, our own personal stories, and weaving in our own personal stories to make sure that they understood, whether it be the congressperson themselves or the staff member, that they understood what the Paralysis Resource Center means to the paralysis community. Regional champions after this coffee session received templates and background information, educational information, to help them really convey their own experiences, whether the PRC has impacted themselves or their family, to their members' offices on Capitol Hill or virtually. In July, as Angel mentioned, we hosted a congressional briefing alongside the Amputee Coalition, where advocates from both of our organizations helped spotlight the value of federally funded disability resource centers. It was truly an excellent turnout. We even had a congressional meeting that day with one of our regional champions who actually met with their own member of Congress. But we had great grassroots advocates from both organizations come. We even had congressional staff members join in this congressional briefing, and very interesting. One of the staffers who joined the briefing was actually coming from former Senator Marco Rubio's staff, and Senator Rubio has been a congressional champion. And he knew a lot about the PRC and the services we provide to the paralysis community. So this staff member actually came onto the majority side of the House Appropriations Committee. So it was really nice to know that they know who we are, and they met with some advocates, and just being there, seeing how these resource centers really help the lives for individuals living with disabilities. So thank you to all who joined us. If you were able to come to DC, I know we had a couple of regional champions there, and it was great to see your faces and be present with you at this event. And then the last bullet point I have on this list is really in August, when the summer was coming to a close, we hosted another coffee session. Actually, it was led by Sherman, who, thank you again, Sherman, for doing that. But really this coffee session focused on building up our grassroots strength, learning the different types of outreach methods that regional champions can use. And we also spoke about different staff type personalities that regional champions and advocates may meet along their advocacy journey. So Sherman did lead that conversation, and really we were so thankful. It was actually one of Sherman's first interactions with our regional champions in his new role at the Reeve Foundation, and just so appreciative of that. So let's get to, and I know you hear me say this all the time, and I've been thanking you guys all, but really, I just want to take a moment just to say thank you again to our regional champions and advocates all across the country. You went the distance this summer, and each action that you took, you used your lived experiences, your voices, and really powered through this summer in educating Congress on the PRC. I think this past summer we had almost like over 40 meetings with congressional offices, which is truly amazing. And that is direct voices, direct lived experiences getting to those members of Congress and educating them. So you all responded to our calls to action. You listened to our different outreach strategies and really educated your members. And we do need to keep this momentum up as we head into the fall and winter. And I do know it's October, so it is already the fall, but we just got to keep this momentum up. So let's look ahead. Just a few items here. There will be another action alert coming out soon, and as you could all guess, it will be urging our advocates to reach out and educate their members of Congress on the importance the PRC has and the importance of PRC funding for next year. I do also want to highlight that we'll be having another Regional Champions Coffee session, which is going to be set for, I believe it's Wednesday, November 12th, 2025, from 2 to 3 p.m. Eastern Time. And the theme of this coffee session will be the future of disability policy. So I want all regional champions who are listening to please join us. And we want to hear from you. We want to hear what's happening in your own local communities. And it will be a very nice listening session and just a nice gathering to see one another and talk about our advocacy we've done this past summer and what's to come. I will share the link to the coffee session in my next Regional Champions newsletter. For those of you that are listening that are wondering, what is this Regional Champions newsletter? Where can I get this Regional Champions newsletter? Well, you have to be a regional champion to get the newsletter. And if you're interested, I did put my email on this slide. So please reach out to me and we can set up a time to talk and just, I can learn a little bit about you and tell you more about the program. But we're always looking for new regional champions. So please, if you are not one right now, please join us. It is truly a great program, and I'm not trying to be biased. It truly is, and you do make a really big impact, especially on Capitol Hill. So take down my email. And I also just want to say these slides will be available in the follow-up email, so you don't have to worry about taking screenshots or taking information down. We will be sending these slides out in the email, so it will be there for you. All right, so I think that is everything, and we can get to the Q&A session if there's any questions, but I want to hand it back to the group and just thank you all for listening. Thank you all for being involved with the Reeve Foundation. And yeah, I'm excited for this fall and winter. Does anyone have any questions? Let me see.
I answered a few while
Oh,
you were
okay.
speaking, Gerard. There was just a question about the phone number on where to reach out to file complaints with DOT. So I responded with that, but just like Gerard said, he's going to send a follow-up email, which will include all of those, all that information.
Yep. Thank you, Angel. If anyone doesn't, oh, I think I see a question pop up. There's a question from, it's anonymous, but the question reads, is it worth to, oh, I took it live. Is it worth it to visit local offices of the representatives? And the answer to that question is yes, visit your district offices. You can find the district offices on your members' website. So you just got to type in your member's name, go to their website, and it'll tell you all their office locations. If you need any assistance trying to get in contact with these local offices, you can email me and we can figure out who your member is and get you the correct contact information. But yes, it is totally worth it to go to the district offices to speak with either a staff member or go to local events that the member will be present at and really get your concerns across. This is how advocacy works. So that was a great question. Thank you. I don't think we have any, oh, do we? Okay, this question states, do you have any advocacy education efforts to private insurance companies about medically necessary and critical equipment needs, DME, that SCI folks need? Let me just reread that again.
Say, if I'm reading this correctly, we at the coalition level, I can say that the majority of our advocacy efforts are to CMS, the Centers for Medicare and Medicaid Services. But usually what is implemented by CMS rolls down to the private insurance companies. So, but we definitely do a lot of advocacy regarding DME and equipment needs. We have been meeting about to try and get a national coverage determination opened up with CMS for standing power wheelchairs. We've been working on this before I was in this role, but we were able to get an in-person meeting to talk about this and hopefully get that moving when the government opens back up. So that is definitely something that we do work on. And if there is a specific issue that you are having with your personal DME, reach out, contact the Paralysis Resource Center. We have our information specialists that are there just to, these are one of the many things that they can facilitate helping you and find the support and services that you need. So we can drop a reminder in this chat of how to reach out to the IS department, or Gerard, you can follow up with that info.
Yes, thank you, Angel. I think that is all the questions we have on the Q&A, if I'm seeing this correctly. Bear with me here. Pat, you asked a great question, and hold on, let me just, sorry, my computer keeps freezing. Pat, you asked a great question, and we're going to be talking about that as a team and decide going forward how we are going to approach this as regional champions. So thank you for asking that question. And the question was, is there during the federal government shutdown, are they now focusing on letting go of federal workers that deal with special education and specifically IDEA? As regional champions, is this something that we can talk about, or is this something that we do just as an individual advocate? So I was just answering Kat's question for that.
And I don't want to discourage you from, if this is something that's important to you as a citizen, you can speak and advocate on this as a citizen, not just on behalf of the Reeve Foundation. You don't necessarily have to wait for us if that's something that it matters to you. But we are hearing about that, and we were just speaking about this earlier. So know that we are on top of that as well.
Yes, and Kat, please feel free to email me if you need help strategizing or anything, or just I'm always available. So please email me. So this next question is from James. Could you talk more about advocating for standing wheelchairs to, I believe that's CMS?
Sure. So, let me read. Sure. So James, I know that you were definitely involved with our advocacy efforts for the seat elevation, that advocacy that we did to get CMS to cover those. The initial request back in 2020 was for coverage of standing power wheelchairs and the seat elevation. So they moved forward with seat elevation coverage, which was awesome, an awesome advocacy win. And so we have gone back to them, asking them to open up a national coverage determination for standing. In the previous administration, it was really hard to pin them down on this and to get a meeting on this. But we were able to meet with someone who is going to be leading this up in the Trump administration at the end of August. There is a lot going on right now, but she knows that this is important. And I feel like we might see some movement on this in 2026. So I can't really say, it hasn't moved yet, but it is moving. And I will connect with you, James, because I think we could probably use you for some story gathering on this topic. Ooh, there's a question about how to become a regional champion. Gerard will be showing up at your door, like by the time this call is over.
Is there? Okay, William, I will be reaching out to you. So that is a great question, but really how do you become regional champion is, like I said in the webinar, please reach out to me. We usually set up a call time just to kind of talk through just some of your advocacy experience. And again, you don't need to have any experience. It's okay. But really I'll talk to you more about the program and what regional champions do. But we would love to have you. So I will take down your contact info and you will be hearing from me soon. I might not show up at your door, but yeah, you'll be hearing from me very soon. if there is, we still have 10 minutes left, but if there's no more questions, I think we can wrap it up. I just, again, thank you all for being, we had a lot of questions, which is really great. And thank you all for being very engaged and open about this. So we really appreciate you all joining us, and stay tuned for more updates.